on vaccine supply and the rollout and set out the facts, given some of the speculation that we've seen overnight. Let me set out the position absolutely straightforwardly. Throughout the vaccination programme, the pace of rollout has always been determined by the availability of supply. As I've said in this House many times, supply is the rate-limiting factor. The process of manufacturing vaccines is complicated and subject to unpredictability. And because we get supplies out into the field so fast and run a highly lean delivery system, changes in future supply schedules impact on the weekly availability of vaccine. This has been true throughout. We make public commitments to the goals we can reach according to our best estimates of future supply. That supply goes up and down. We are currently, right now, in the middle of some bumper weeks of supply. We've now reached the milestone of 25 million vaccinations within the first 100 days of rollout, and we've therefore been able to open up invitations to all people aged 50 and above. And yesterday, for example, we delivered over 500,000 vaccines, and we will do so again today. In April, supply is tighter than this month, and we have a huge number of second doses to deliver. During April, Madam Deputy Speaker, around 12 million people, including many colleagues in this House, will receive their second dose. These second doses cannot be delayed, as they have to be delivered within 12 weeks of the first dose. In the last week, we've had a batch of 1.7 million doses delayed because of the need to retest its stability. Events like this are to be expected in a manufacturing endeavour of this complexity, and this shows the rigour of our safety checks. And we have a delay in a scheduled arrival from the Serum Institute of India. Now, I want to put on the record my gratitude to the Serum Institute of India for the incredible work that they're doing producing vaccine, not just for us in the UK, but for the whole world. Their technology and their capability, which has been approved by the MHRA, is remarkable. The Serum Institute of India are producing 1 billion doses of the Oxford AstraZeneca vaccine this year. It truly is a partnership that we can be proud of. I also want to put on the record my thanks to both AstraZeneca and Pfizer, who've been remarkable partners in this historic endeavour. We have committed to targets on which it is vital to say that these targets to offer the vaccine to everyone aged 50 and over by the 15th of April and to all adults by the end of July. I can confirm that we are on track to meet both of these targets. I also want to clear up some rumours that have been circulating and give people reassurance. There will be no weeks in April with no first doses. There will be no cancelled appointments as a result of supply issues. Second doses will go ahead as planned. Most importantly, the vaccine data published yesterday show the life-saving impact of this vaccine. It's not just that the vaccines are safe, it's that they make you safe. You are much safer having had one. And shortly, the MHRA will be saying more on this matter, which they, of course, keep under constant review. Madam Deputy Speaker, I know the House will also want to hear some good news from Gibraltar. Throughout the crisis, we've provided Gibraltar with PPE, testing, and a sovereign guarantee for their COVID spending. We have also provided Gibraltar vaccines, as we have with all other British overseas territories. And I'm delighted to be able to tell the House that yesterday, Gibraltar became the first nation in the world to complete its entire adult vaccination programme. I want to pay tribute to all Gibraltarians for their fortitude during this crisis and the kind words of First Minister Fabian Picardo, who said yesterday, "The United Kingdom has played a blinder on vaccinations and we are among the beneficiaries in the British family of nations." I agree. The vaccination programme has been a success thanks to a team spirit across the British family of nations. It hasn't always been easy. Of course, there are challenges thrown at us in what is the biggest civilian undertaking in history and that affects every single one of us. The whole House pays tribute to those who've helped to make it happen, including Emily Lawson and Kate Bingham, Maddie McTiernan, Ruth Todd, Nikki Kanani, Professor Jonathan Van-Tam, Sir Chris Whitty, Sir Patrick Vallance, Wei Shen Lim, Sarah Gilbert, Andy Pollard, Pascal Sorio, my officials in the department, colleagues across this House, and so many others who've made this a success. With 25 million people vaccinated and a clear roadmap out of lockdown, we are taking careful steps out of this pandemic. Now, Madam Deputy Speaker, there are 7,218 people in hospital with COVID across the UK, down from a peak of almost 40,000 just 7 weeks ago. The rate of hospitalisations has halved in just the past 16 days. And thankfully, the rate at which people are dying has fallen by a third in the last week. As a result, I can tell the House that we are, from today, writing to all those clinically extremely vulnerable people to let them know that shielding will come to an end on the 31st of March. I want to thank all those who've shown such fortitude and all those who've done so much to look after the most vulnerable. The shielding programme truly has been Britain at its best, pulling together to help those most in need. And Madam Deputy Speaker, I know that colleagues in the NHS and social care are beginning cautiously to look to the recovery ahead. I know everyone in this House is proud of the life-saving work we've seen in hospitals across the country. Yet we also know that our battles against COVID-19 have meant that there are things that we've not been able to do, like routine treatments and operations. And the challenges of COVID are still with us. We must continue to treat patients with the disease, bolster our vital mission of infection control, while also laying the groundwork for a recovery that gets us back to where we need to be. We've backed the NHS at every point in this pandemic so that they can treat patients, stay safe and save lives. And I'm delighted to inform the House that we're backing them again today with a further £6.6 billion of funding for the first half of this coming financial year. This money is in addition to the £3 billion committed at the spending review last November to help the NHS meet the additional costs of COVID, while critically starting the work on the elective recovery ahead. Due to the pandemic, the waiting list for elective treatment in January was almost 4.6 million, and 304,000 people are waiting more than a year for an operation or diagnostic. Before the pandemic, we reduced the number of 52-week waits, so people waiting more than a year, from 20,000 in 2010 to 1,600. And we were in fact on track to get that number to zero, Madam Deputy Speaker, before the pandemic hit. This backlog of elective work is an inevitable consequence of the pandemic, and I know how NHS colleagues are as determined as I am to put it right. We're also putting £594 million towards safe hospital discharge. Over the last year, the NHS's existing discharge programme freed up over 6,000 beds, and with it, the valuable time of 11,000 NHS staff. We can be grateful that we're seeing so many people leave hospital and that our discharge programme has shown the way forward, ensuring people can get the very best of care outside of our hospitals, helping them off the wards and into the right settings with the right support at the right time. Our £500 million mental health recovery package will help tackle the challenges that the pandemic has wrought in access to mental health services. And I can also confirm that we'll be extending enhanced discharge arrangements for mental health patients, getting patients safely from hospital into healthy community settings, providing better care and freeing up thousands of beds. And this challenge of mental ill health is so important. We all need to keep looking out for each other and doing all we can to strengthen our mental health. Tackling mental ill health is a core objective of our NHS long-term plan, and this government is committed to seeing mental health treated on a par with physical health and deliver on the long-needed reforms that we've set out. Madam Deputy Speaker, I am equally committed to supporting the vital work of our colleagues in adult social care. Last Monday, we reopened care homes to visitors with a careful policy of a single regular visitor who will be tested and wear PPE. I know how important this is, and I know colleagues will be cheered by the stories we hear each day of more and more residents safely reunited with people that they love. It means everything to them. I can today announce a further £341 million to support adult social care with the costs of infection prevention control and testing that will make sure visits are safe for everyone. This takes the total infection control fund and testing support to more than £1.6 billion, alongside the free PPE that care homes receive. Madam Deputy Speaker, the pandemic has tested our NHS and our social care system like never before. That they have risen to meet the challenges of the past year is down to the incredible dedication and hard work of colleagues. They have our thanks. We will deliver on our commitments. We will build 40 new hospitals. We will hire 50,000 more nurses. We will vaccinate this country ahead of almost all others. We will back our NHS and social care as we build back better for everyone. And I commend this statement to the House.
I call the Shadow Secretary of State, Jonathan Ashworth.
Thank you, Madam Deputy Speaker, and as always I thank the Secretary of State for advance sight of his statement. Now, our constituents will be worried and anxious and disappointed at the news on vaccination last night. It has been an unspeakably horrific year. We've got one of the worst death rates in the world. Our economy has taken a massive hit. Many key workers under the age of 50, like teachers and police officers who through the nature of their work are not at home, they are going out, they are more exposed to risk, had been hoping that vaccination for them was not far away. So we understand why there will be delays in supply. Of course we understand that, but this is not fantastic news, and nor, frankly, is it expected news. On Saturday, the government sources at least, were briefing the Daily Telegraph of a bumper boost that everyone over 40 would be offered their first vaccine by the Easter. Last week, the Business Secretary was hinting that all adults could be vaccinated by June, saying there's no reason why we can't be optimistic. On Monday, Nottingham and Nottinghamshire CCG began inviting those in their 40s for vaccination. There was a similar invitation went out from Bury CCG as well. So we are grateful for his update today, but it will be a surprise to many. He didn't mention Moderna supplies today. I understand that supplies from Moderna will start in April. Is there any prospect that if Moderna supplies come on stream, that new appointments can be offered in light of this? Now, about 11 million people received their first dose between January and February, and I listened carefully to what he said. Can he just clarify for the House and for our constituents, is he offering them an absolute guarantee that all of those will get their second dose within the 12 weeks throughout April? Our constituents will be keen to just get that absolutely clarified. Now, the vaccination programme will need to ramp up to about 3.5 million doses a week from May to ensure that everyone under 50 is vaccinated by mid-July. Is he confident that these supply issues will be fixed by May? And is there any prospect of doing more than 3.5 million jabs a week from May? So, because, for example, we heard today from Adam Finn of the JCVI that infection rates may rise as a result of the delays. Does he anticipate that any of the stages in the roadmap easing out of lockdown, when any of those dates will be pushed back, given that we are quite rightly judging that roadmap by data, not dates? Can I also, on behalf of the official opposition, Madam Deputy Speaker, take this opportunity to support the AstraZeneca vaccine? Now, of course, where people are worried and have concerns, those worries and concerns must be addressed and not dismissed. But this is a concern at the moment. I mean, yesterday, for example, I was told that hundreds of people failed to show for appointments at the Excel Centre, and we think that is because of concerns and misinformation circulating online. And there are parts of the country where infection rates remain relatively high and vaccination rates relatively low. I see this in my own Leicester South constituency. So will he pull together a cross-party task force of community and local leaders to look at tackling these vaccine hesitancy issues? I offer again to work with him on that on a cross-party basis. Madam Deputy Speaker, children make up around 21% of the population. So that is a large segment of the population who will be lacking immunity. Obviously, research and trials are ongoing, but does he have a timeline for when he hopes to vaccinate children? Does he anticipate, for example, being able to vaccinate children this autumn, as Anthony Fauci in the US has suggested could well happen over there? Because even as vaccination rolls out, the virus continues to circulate, and new vaccine-evading variants could emerge. And we may need booster jabs in the autumn, and winter will be challenging. So driving up vaccinations across the whole of the population is so important. Now, on these budget allocations that is announced for the next 6 months, finally, I welcome extra funding, of course. Can he guarantee that the NHS will continue to get additional funding after the 6 months if needed for COVID care? But as he references, people are waiting longer for treatment, over 300,000 people waiting over a year, risking a permanent disability or loss of livelihood, thousands waiting too long for cancer treatment, risking loss of life. But we shouldn't have to choose between cancer care and COVID care. We're also facing a mental health epidemic as a consequence of this crisis. But crucially, Madam Deputy Speaker, when we entered this pandemic, because of years of underfunding, bed cuts and understaffing, we had growing waiting lists. Our I&Es were in crisis. We were missing cancer targets. So can he tell us when he expects to bring down these waiting lists and meet the various cancer targets again, Madam Deputy Speaker? And finally, he didn't mention NHS pay today. He claps NHS workers, he claps nurses, but he is introducing a real terms pay cut for our NHS staff. Can he tell us whether he will implement any recommendations of the independent pay review body, and if they recommend an increase above 1%, can he assure us that the funding will be additional to what he has announced today? But in truth, Madam Deputy Speaker, if he really wants to value NHS staff, he should withdraw this pay cut now.
Secretary of State.
Thank you very much, Madam Deputy Speaker. Well, I welcome the right honourable gentleman's support for the vaccines, the vaccine rollout, and the clinically led approach that we've taken in this country. And I mean that as more than simply a polite gesture. I think it is vital and important in this country that we have such a strong cross-party consensus, which includes all parties represented in this House, behind the vaccine programme and behind the science. And the science means, of course, that we should, and we do, publish any side effects, and we are open and transparent about that. But we also make an assessment as to the benefits and how those benefits weigh against side effects. And it is absolutely clear from the data that we've seen so far that the vaccines are both safe and they make you safer than not getting vaccinated. And that is an absolutely critical fact. And the MHRA will very shortly be setting out more details, and it is properly for the independent regulator to set out those details. He asks about supplies from Moderna. We do expect supplies from Moderna in the coming weeks, and I'm very grateful to Moderna for the work that they have done. Of course, we've always been cautious about setting out future supply details, and the experience of the last 24 hours makes me even clearer that it is far better for us to set out clear commitments to the public in terms of when people can be vaccinated, which means all over 50s now can come forward, and we are committed to and on target to offer to all over 50s and groups 1 to 9 by the 15th of April. But we know that supply figures move up and down, and we've seen that throughout the rollout, and that is part of the normal management of this rollout. The commitment I can give him is that those who are coming forward for second doses, those appointments will not be delayed because of these supply issues, and also appointments that are already made will not be cancelled because of supply issues. So therefore, to anybody, any member of the public who's watching, what I'd say very clearly is that the vaccination programme is on track to meet the targets we've set out. If you get the call from the NHS, whether you get it through a letter, text or telephone call, Madam Deputy Speaker, or even these days an email, take up the offer and get the jab. He asked rightly about the roadmap. We are on track for the dates in the roadmap, and there is no impact on the roadmap from the changes to vaccine supply that we've been detailing in the last 24 hours. He asks for about the vaccination of children and the autumn vaccination programme. Neither of these are certain. The vaccination of children is currently being assessed in a number of different clinical trials, and it's very important that we consider the results of those before making any decision. And it is likely that we will need a vaccination booster programme in the autumn, not least to deal with new variants, but that is, again, not yet certain. Finally, I'm very glad that he welcomed the extra funding that we're putting into the NHS. He asked whether after 6 months there will be more funding if needed for COVID purposes. The Chancellor has been absolutely clear from the start of this crisis that the NHS will get what it needs to deal with COVID, and that is very important, as is the work to restart the NHS in areas where it's had to be paused, and critically, the work that colleagues across the NHS will be doing to recover the backlog of elective work and make sure that everybody can get their appointments and their operations in a timely way on the NHS once more. That is the work of the months ahead, and I look forward to supporting NHS colleagues in delivering on it.
We now go to the Chair of the Health Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker. Was the Health Secretary as concerned as I was by comments by former Finnish Prime Minister Alexander Stubb on the Today programme this morning about the threat by the Commission President to block exports to countries that were ahead in their vaccination programme? He said that was a political reality, irrespective of any breach of legal contracts that it might involve. Does he not agree it's incredibly dangerous to make threats to the supplies of vaccines and components, alongside casting aspersions over their safety, at the very moment when vaccines are the only way the world is going to get out of our COVID straitjacket?
I agree with every word that my right honourable friend has said. I think that it is vital that we all work together. These supply chains for the manufacture of these vaccines cross borders. They are often global supply chains, and it is vital that we work together to deliver them. And there is a need for that cooperation, and there is, of course, a need for all countries to respect contract law. That is the basis of international trade, and I'm sure that the European Union will live up to the commitments and statements that it has made, including President van der Leyen herself, who has said that there should not be restrictions on companies when they are fulfilling contractual responsibilities. Of course there should not, and we fully expect those contracts to be delivered on, because there are very significant consequences to breaking contract law. There's one further point, Madam Deputy Speaker, which is that the Oxford-AstraZeneca vaccine was developed because of UK taxpayers putting the funding in to the science, to the development, to the clinical trials, and because of AstraZeneca, with an incredibly bold and generous decision, which we fully support, but was their decision, to offer this vaccine around the world at cost. Working with institutes like the Serum Institute of India, Oxford and AstraZeneca are providing a vaccine for the whole world. They are not taking a profit from it. We are very proud of that fact. And that makes this materially different to other vaccines which have been developed for commercial advantage. I'm not against that at all. But let's celebrate what AstraZeneca have done. And it only underlines how important it is for everybody to work together in order to keep their populations safe.